This is a 71-year-old female. She tripped and fell, how many, like a week ago? And she kind of fell on grass on an outstretched right arm. She has pain raising her arm, limited motion.
Here we're down to the pec major tendon. We can see the biceps tendon underneath that, and there's a moderate amount of fluid that's circumferentially surrounding the biceps tendon, which you can appreciate here. So again, there is a moderate bicipital sheath effusion here. You can appreciate the deltoid muscle, the short head of the biceps muscle, just medial to the biceps tendon. Here we're now looking at the subscapularis tendon in long axis. Appears to be some moderate thickening of the tendon and some intrasubstance tearing, essentially, of the tendon, as well as a partial bursal-sided tear going towards the lesser tuberosity. Here we're going to look at the subscapularis tendon in short axis. You can appreciate somewhat of a divot in the bursal surface of the subscap tendon, which is concerning for a bursal-sided tear. And the signal underneath that, the low signal, may be part of that bursal tear versus some intrasubstance tearing as well of the subscapularis tendon. Now we're looking at the supraspinatus tendon in long axis. Fortunately, this is the most impressive finding on ultrasound. You can appreciate a large overhanging subdeltoid bursitis here. And here you can see a full thickness tear of the supraspinatus tendon. It's acute, basically an echoic signal going from the articular all the way to the bursal surface, consistent with a full thickness tear. You can also appreciate a cartilage interface sign, which is another clue to a rotator cuff tear as well. Here again, you can appreciate that full thickness tear, and the supraspinatus tendon lost that fibular texture as well, probably because there's a lack of tension on the fibers from this tear. Here it almost looks like a complete supraspinatus tear, so perhaps this part of the supraspinatus tendon is almost gone. That may be some collapsed subdeltoid bursa versus some residual fibers of the supraspinatus tendon. Here again is a good cartilage interface sign.